Okay. Welcome everyone to our Aeroflow webinar discussion. Really pleased to have you with us today. And if you're watching this by recording, thanks for checking us out. Today we're going to be talking about open enrollment. As many people who work in Medicare Advantage understand, this is the annual enrollment period, or AEP. And the things we're going to talk about today in terms of best practices are applicable, though, not only for the annual enrollment period, but for open enrollment periods in general. So across different lines of business as well. Just a little bit of housekeeping. Please mute yourself when you join the webinar. This is not one of those auto mute situations, so please do that when you join and submit questions in the chat. We'll be monitoring those, and after we get through a few questions, we'll come back and answer audience questions. So before we begin, I would like to briefly have our guest today introduce herself, and then I'll introduce myself after that. Denise?
Thanks, Mike. Nice to be here, everyone. My name is Denise Doucette-Janice. I am a registered nurse by background, and I currently serve as the Director of Medicare Member Experience for Point 32 Health, which is the parent organization of Tufts Health Plan and Harvard Pilgrim Healthcare. I entered the nursing profession after spending about 15 years building an environmental service company and immediately found my clinical passion in hospice and palliative care. And throughout my career, my goal has been to merge my business acumen and clinical expertise to benefit both consumers and providers in the healthcare space. In my current role, I'm focused on creating a comprehensive, personalized, and diverse Medicare member experience strategy with the goals of improved member satisfaction, clinical quality, and member retention.
Great. Well, so pleased to have you with us today. Thank you so
Thank you.
much. Looking forward to our conversation. And I'm Mike Cantor, Chief Medical Officer for Aeroflow Healthcare. I'm a fractional Chief Medical Officer for digital health companies, also with a lot of focus on home-focused healthcare and value-based organizations more broadly. My experience includes health plans, health systems, and also organizations like Aeroflow that work with health systems and with health plans to really provide the best possible care for their patients and members. So really looking forward to this discussion, which is going to focus on this annual enrollment period and some of the transitions that people face and some of basically what are the best practices? How do we encourage members that are making this transition, signing up for a new plan, or even continuing their current plan to make sure that what the services that they're getting today and durable medical equipment they're getting today, that they'll be able to continue that in the future. I'll come back to this in just a minute. So I'm going to stop sharing my screen for a moment so we can have this chat. So Denise, what were you looking forward to? Looking back a few weeks now, open enrollment period obviously runs from the middle of October through early December. What were you really looking forward to this year?
Yeah, so it's a great question. AEP really provides us as the health plan the opportunity to serve our existing members and then also to reach out to potential new members. So I'm always excited for the opportunity to help individuals and families find the right plan that suits their healthcare needs and their financial situation. So I know I'm a little geeky, but I'm always excited when we introduce new plans and innovative benefits to meet the evolving needs of our members. So we've got some great plans going into the marketplace this year, and we're seeing fantastic momentum already. So it's very exciting. And then, of course, on the clinical side, as a nurse, I'm always focused on promoting preventive care and wellness programs. So AEP is also a great time to emphasize the importance of regular checkups and screenings and vaccinations.
Fantastic. Anything specific that changed this year from a CMS perspective that might have impacted how your team is approaching AEP or that health plans need to be aware of in terms of what's different this year versus previous years?
Well, I think, CMS always tries to throw a few wrenches into the rightfully so, like to throw into what we've done previously. We've had to really look at, how we market, the things that we use for marketing, the timeline that it takes to get things approved, because that's a new thing this year for health plans. So just trying to maneuver some of those nuances, but we've got a great team and we've really, I think, started very early. And I think that's the key for most health plans is something we'll probably talk about. As soon as this AEP is over, we start planning for the next one. So that's really best practice, is to just keep the ball rolling, for sure.
Absolutely. And I think that's been my experience as well, is that it's sort of a never-ending process. You're either just about to start you're in AEP or you're dealing with sort of all of the work that happens between AEP and when that ends and when people actually join the plan and the plan begins to offer the benefits that the people have signed up for. And so I think
Absolutely.
thinking through AEP is not sort of just a few weeks, it's actually a year-long process. These few weeks are obviously critically important because this is when people are deciding which plan, which products, all that they're going to sign up for.
Yep.
Really, the decisions that are being made now have been influenced very significantly by the experience that those members have had during the year with their existing plans, or if they're new to Medicare or thinking about switching, maybe some of the not so good experiences they've had with their current plan or with fee-for-service Medicare, realizing that Medicare Advantage plans today offer a much wider array of benefits
For
in
sure.
most cases than what people can access through their traditional fee-for-service Medicare and Medigap plans.
Absolutely.
Fantastic. And given that we're now sort of 3 weeks in, week number three, I think, several more weeks to go, anything sort of out of the ordinary that's popped up this year or any trends that you're observing in terms of the way this is going now?
I mean, it's interesting. No, I mean, it depends on the market, but in general, I'm seeing at least in the Northeast. So, we work a lot with broker partners, and that channel is performing exceptionally well. I think our broker partners play a vital role during AEP. They offer members expert guidance, beneficiaries expert guidance and ongoing assistance. And with the ever-present evolution of health plans in various markets, I really do anticipate that these partners are going to play an increasingly significant role in future AEPs. And that's something, quite honestly, it can be a little bit new. And I think, something that we need to keep evolving in our partnerships with those folks. But that's what I'm seeing.
Interesting. When I was doing more work directly in Medicare Advantage, we saw about 50% of the new enrollments came through the web. So there
Mm-hmm.
was sort of direct broker involvement. But for the other 50%, like you said, those broker partners are incredibly important because they tend to be the trusted resources in the community. People
Absolutely.
look to them for answers, and it is very complicated. The good news is that there are many new and different kinds of plans, especially when we consider the supplemental benefits that a plan may offer. That's great. But on the other hand, it means you have many more choices and lots more sort of things to weigh from a financial perspective in terms of the balance between premium and specific benefits and coverages and all the rest of it. Are you still seeing strong sort of online signups, or is that changing? Are people going back to more of the old school, talking to a broker or a Shine counselor or
It's
dealing with
interesting for
Medicare
me.
experts?
Yeah, I mean, I think I'm seeing a little bit of reversion to previous days. I mean, I think COVID really, I think changed that a bit, and even with when you talk about telehealth or different modes of communication electronically. But I feel like people are getting a little bit more back to like the in-face, face-to-face conversations, pen and paper, really want things that are tangible. So it's interesting. I think that's going to evolve too. I think the important thing I think to understand is that you need to meet members where they are. So if it's a member who wants something by electronically, we should have that capability. If they want to engage via text, we should have that capability. If they want paper, and being able to really predict what those preferences will be, or at minimum capture those preferences, so you can really speak to members the way they want to be spoken to.
Totally agree. And it's interesting about COVID. Literally, it used to be that this is a time when there were lots and lots of lunches and meet and greets,
Mm-hmm.
tables set up and practices to help people understand, which plans might work best for them. Are you seeing much more of the sort of in-person activity and better attendance of those activities, or are people still reluctant to go and have more of the face-to-face or in person?
I think definitely it's a mix of both. I mean, it's certainly the difference I think lies in is that you have to offer a web option. Like it's, so we're doing both. So if we're doing, member meetings, we're offering something on site because there are folks who like to come and again, like to have that face-to-face contact. But then there are some that either for whatever reason, either they're not comfortable or they're just really busy. And it's just easier for them to log onto a computer and grab a web meeting. So you have to be able to offer both.
Got it. And so in some ways, it's sort of gotten more complicated after COVID, like everything else in healthcare, it seems,
But
rather than,
hopefully better for beneficiaries in that they have options. They don't feel like they need to go somewhere in person to sit down. They can, either grab a webinar, and also there are those folks who want to self-service. So they want to be able to go on the website themselves, and they want to be able to look at the plans. They want to be able to go to medicare.gov, see where everybody is, go on the plan's website, look at the plans. I mean, you have to have those capabilities for folks.
got it. When you think about it, many Medicare beneficiaries today, many of your members, have sort of ongoing services that they're accessing, and not just primary care or specialty physician care, but things like durable medical equipment, home
Mm-hmm.
health, other services where there needs to be continuity of care if they change plans. What are the best practices for identifying proactively who those folks are? Because, like you said, there are lots of financial implications. It is both the service and the benefit design, but it's also the financial implications of changing benefits or changing plans might have on benefit coverage. How do you think about sort of informing people, especially those who have ongoing services, how they can make sure that by switching plans, they're not really having a negative impact on their ability to continue to access those services?
Yeah, so I think it's key in terms of informing current and future members. Um, you have to have clear, personalized communication, again, through various channels. Like, you have to be able to communicate that information in the way that a member is going to want to receive it. Timely notifications, highlighting specific changes in cost sharing and processes, using visual aids, because that's really key too. Maybe you have to offer an educational session, like I said, a member meeting, if that's something that that folks are need. Collaborating with healthcare providers, so you need your providers to understand what changes there are going to be, or if there's going to be a change from plan to plan, and then establishing a feedback system. So you need to be able to know if what you're doing is working. So strategies like those are going to ensure that members understand the impact on their services and hopefully reduce confusion and promote a positive experience.
Got it. We talked about how an enrollment period is sort of a year-long process. So
Mm-hmm.
between the time when people make a choice during AEP, whether to stay, a member staying with their existing plan or switching to a new plan or joining a new plan, is that the time when you're reaching out and saying, hey, we know that you're on oxygen, let's say, you're going to continue on that and it's still covered because you haven't switched plans, or perhaps you're someone who is on a continuous glucose monitor. Here's what the requirements of your new plan are in terms of whether it's pharmacy benefit or medical benefit, or whether it's how you get the tubing set up and all the rest of it. Are you proactive about that? And if so, what's the best way to do that and make sure that the right people are being contacted and identified?
Yeah, absolutely. I mean, and I think that's where our population health team really comes into play, because many times they are engaged with these folks and they're having continuous conversations about changes in plans or changes in situations at any time of the year, quite honestly. So we really rely on those folks to be able to make sure that those members have a smooth transition if they're changing plans or if they're leaving our plan, quite honestly, because I think as clinicians, we want to make sure that members have a soft landing no matter where they go. I mean, certainly we hope that they're going to stay with us, but if we need to help folks make a smooth transition somewhere else, and we're going to do our best to do that as well.
Great. Are there any specific pitfalls? Like, are there any examples of cases where you've seen it not work out so well and had to kind of dig out? It's always better to be.
Yeah, of course. I mean, there's going to be those. I mean, I think it's you have to be able to, again, provide clear information. But I've seen folks who are coming on to our plan, with, say, oxygen, for an example, and then they're trying to figure out is this DME provider covered? Do I have to go see my physician again for another prescription? I mean, there's a lot of that, and I think that's where proactive identification is key. And if there's a new member, really identifying that person as they come on board. So whether that be through a broker partner, but it's that sign up, right? And then having that information flow downstream to the plan. I know for us, shortly after onboarding for new members, we deploy welcome calls to a subset of our members. So our goal is to gather any of that information, at the time of the welcome call if we haven't gathered it prior. And then also we deploy a health risk assessment to our entire population because we want to identify members' needs, including DME, because we want to use that to avoid any continuity of care challenges. So it's really, I think, multimodal communication, information sharing, to just try and get as much of that upfront as we can.
Totally makes sense. And I think, like you said, it's being proactive, meeting people where they are, and the multimodal piece. So not just phone calls or on the web or brokers, but everything you can do. You really have to kind of look at a continuum almost and look at the totality of how you're communicating, messaging, making sure it's consistent, making sure identifying people who have those needs up front, and then able to provide sort of the necessary information so that there's no gap. Because the worst
Absolutely.
possible thing is that someone is using a CPAP machine, and now they need new tubing and they need new water reservoir and they need all this stuff, and they don't know who to call. Their current provider isn't in network, so then they find when they call them that they're referred somewhere else. The last thing you want as the first experience with a plan is for a member to be struggling with an ongoing need that's not being met.
Absolutely. And you're always worried about, the care for the member. So this is, in the end, I mean, this is healthcare. So the experience is one thing, but we certainly don't want to have any kind of gap in care for that member as well.
Exactly. Great. And in terms of the specifics of it, like, what do you think are the most difficult challenges? Like, which cases do you think are the hardest for, like, what's the hardest to get in front of? I mean, is it that people don't have previous claims for particular services? Is it that they are just starting with new diagnoses? What is the best way to kind of, what are the biggest barriers in terms of being able to communicate effectively with people? Is it late
Ooh.
signups? I'm just curious,
I think it's all of that, quite honestly. I mean, I don't know if it's one. I would say, I mean, if it's a new diagnosis, you hope if you have really good relationships with providers, right, and they're hooked into their patients, that they can kind of help guide that a little bit, in that, oh, we're going to, have to get to your health plan, maybe get a prior authorization. I think, we as health plans, we don't make it really simple for anybody. Quite honestly, we don't. We all have different rules. We all use different vendors. And I think that gets challenging for providers to be able to navigate as well. And that's not their area of expertise. So I think if we can help members to understand that health plans are a partner, and that they can reach out to us if they have questions, because I think, I'm, director of member experience. So I run into all the time where we'll call a member and they think that, as the health plan, we're the big bad wolf. Like, we're not there to help them at all. So I think we need to really eradicate that perception of ourselves and help folks to understand, we want you to be healthy. We want you to be healthy. We want to be in your corner. Let us help you, and call us because, we want to help. So I think that we need to do a good job of really putting ourselves out there as a partner, both for members and providers.
And I think that's right. It is a three-way partnership, right? Between the member or patient, the provider, and the plan.
Yep.
Oftentimes, the plan is not seen as being particularly supported by either the providers or the patients or members. And like you said, that's the furthest thing from the truth, because it's always in the plan's best interest to do what's right to keep the member healthy.
Very
That is
true.
always the goal. And the complexities that the health plans have to deal with, that's the thing. It's not like you guys created the system that we're in. We're all trying to manage it as best we can. And I feel like COVID really did make things more difficult. It has made things more challenging, more complicated, whether it's just the lack of communication because people aren't able to go to places they used to be able to go to
Mm-hmm.
literally to get information, or the staffing problems, especially on
I
the
was going to say
provider
there's an
side.
access, yeah, true access problem all over the country. Yep.
If you have a specific need, and you can't access a person on the other end of the phone, and all he gets a voicemail, that is not going to be seen as a win-win. And I think when you think back to that idea of creating this continuum and a multimodal communication process, identifying those members that have needs proactively, doing the welcome call and outreach instead of waiting for them to call you,
Mm-hmm.
ensuring that when those calls come in, that you have the people who are trained and know what they're talking about. Because we've all been in that situation too, where you talk to someone And their answer is, well, let me talk to someone else. And you
Yeah,
get
it's true.
stuck in this chain of, and I think that's where the provider plan collaboration can be especially important, right? To make sure that the patient may think, oh, I need exactly the same thing, but now it's not covered, so I'm really out of luck. When in fact, there are ways to help members navigate that, whether it's by getting an exception to a rule or finding usually there's a very simple way to get an alternative in place for what you've got. So there's the assurance that there will be that continuity, no gap in terms of
Absolutely.
the care that's needed. And health plans are obligated when members do join them to provide continuity of care for at
Hmm.
least 30 days. And so for that first month, you've got time to
Yep.
sort this out. It's not like if you run out of
Right.
something
Immediately. Yes. Right.
that you're going to be out of luck. Absolutely not. And having been through, let's just say, several annual enrollment periods and new member onboarding as someone who's worked with health plans in the past, that the first month or two of the year is a time when we anticipate that we're going to have to help people through this process of signing up, ensuring that they have the information that they need, guaranteeing almost, because that's what's required of the plan,
Hmm.
gaps in care. Because the last thing you want is someone to show up in an ER because they didn't get the
Again,
necessary
not in our best interest to have that happen. Right.
furthest thing from anyone's interest, especially
Absolutely.
again, given the way ERs are working these days.
Very
So
true.
I think that's something that we're all aligned on. And I think it's part of that communication challenge is to be able to help the members in some cases, especially in the Medicare world, the caregivers and their
Hmm.
families understand that the plan is probably the best resource and that all plans have to have availability online that's accessible and readable and legible at the right grade level. They have to have call centers that are available or people you can actually speak to. And in many cases, like you've described, there's a proactive outreach, that there's a group of people whose job it is to call people every day and make sure things are okay,
Yeah. Yeah.
especially during the first, the in between when the enrollment period ends and when the onboarding actually begins in January.
And
So
you're establishing a relationship. Like you need to establish that trust between, I mean, new person coming on, you're a new company. Again, you're the health plan, you're the big bad wolf. You need to establish that trust somehow. And I feel like that's a good way to do it.
exactly. And as someone who's responsible for that member experience, um, I think, the difference between AEP and a new member versus a current member who has a problem, it's really not different, right? It's just a question of the specifics of the information.
Absolutely. Yeah. I mean, I think for our current members, we certainly want them to know that we're available if they have questions. But at the same time, also, in my role, my job is to kind of say, okay, so we've got an existing member. At what point in time do we feel like there might be a need for us to proactively outreach them, like to proactively try to connect with them? So if I'm looking at, our members and I'm seeing someone who hasn't engaged with us in any way for like 6 months, 7 months, 8 months, I'm thinking, so is there a barrier of some sort between them accessing benefits? So that's a person that we want to engage with. We want to say, hey, like, what's going on? We're here for you. Is there anything we can do? And a lot of times those are when you uncover some real barriers to folks getting care. And it may just not be related to the health plan. It could be transportation. It could be, something else. So I think we have to, as health plans, we have to be very creative and certainly, be on the offensive and not just always wait for the calls to come in. I think we're missing the boat if we do that.
Completely agree. And let me just put in a plug. If anyone in the audience who's listening currently while we're live has specific questions, please feel free to put those in the chat. We'll address them in just a minute or two, actually. Um, so please use the chat if you have any questions or want to make comments, and we'll share them with everybody. Another question, and relate just to follow up on what you just said. So do you look at those members that are sort of not accessing any benefits at the end of the year, or maybe this is the time, the fourth quarter of the year, to really do that kind of aggressive outreach and say, hey, we've noticed you haven't done anything all year long. That's not good for your health. Even in a wellness visit or something is sort of
Yep.
an expectation these days. Is that something you're doing? And what are the best practices for that?
Yeah, we do that as well. We look at annual wellness visit. We look at gaps in care. So there's, from breast cancer screening to colorectal screening, are folks getting what they need? And yeah, again, it's a multimodal outreach campaign. So, we text, we email, we send mailers, we make phone calls. I mean, whatever we need to do, we engage our broker partners, we engage our provider partners. So it's whatever we can do to help our members get the care that they need. Yeah.
It's interesting. My experience with the brokers is that they don't just, sign someone up and then disappear, that
They
they're
don't.
act partners throughout the year and are often sort of the early warning system when things are going a little bit awry.
Mm-hmm.
You can hear from them as frequently as the providers, in fact. Providers are also, in many cases, really good at saying, I haven't seen this person in a long time. I can't seem to reach them. Do you have better contact information? That simple issue of how do you contact a new member turns out to be a big source of problems, not just for the health plan, but also for the providers. And that's where brokers who are often in those communities
Mm-hmm.
know where to meet people can actually be quite helpful.
Yeah, if we all act as partners, and I mean, really, we are all in the best interest of our member, our patient, our client, whatever the terminology is. So if we can work together and partner to be able to provide best in class care and services, I mean, it's a win for everybody.
Completely agree. And I think we're coming close to the end of our time together. Is there any, do you have any last thoughts or ideas you want to share before we wrap things up?
Oh boy. I think, again, like we as health plans, we have a lot of information that can help us, really look for members that need our assistance. So I think, it behooves us to do this just, for our members, for their health, for health plans, for our financial well-being, for many things. So I just encourage health plans to look at the data you have, and really engage your members regularly about your services, ask them how they're doing. Members who leave you, find out why they left. Try as best you can to, learn, what you could do better next time. I think we have a lot of information and we just need to gather it and use it.
Excellent advice. And I think part of the challenge is we have a ton of information, but what's actionable, right?
Very true.
Find the things that we can actually do something about. And to your point, being proactive, identifying people who have challenges, especially during transitions, like between AEP and the actual onboarding of the member, that's where there's an opportunity to really figure out and identify where those gaps might occur and to keep them from happening rather than having to respond to gaps
Absolutely.
once they've occurred. So thank you so much for your very, very helpful thoughts about best practices for AEP and beyond for health plans working in this area. It's been a pleasure talking with you today. And let me just share a few housekeeping questions. Let me just share my slide again one last time. Hopefully everyone can see this now. So for those of you who are joining us today, we will be sending you a link to the webinar that you can go to on demand at your convenience. So please do that. Feel free to share that link with other people as well who might be interested in taking a look at this webinar. Also subscribe to our newsletter and be sure to follow. There are several other webinars coming up. The next one actually is going to be on November 14th. It's going to focus on latest with continuous glucose monitors. And we have an outstanding panelists joining us for that conversation as well. So I hope you'll be able to make that too. Please take the survey at the end of the webinar. We really, really want to hear your feedback so we can continue to improve and make these better. And then don't forget to register. We'll be sending information about how to do that for the next webinar on November 14th about continuous glucose monitors and best practices for that. So again, thank you so much, Denise, for your time today. Really appreciate it. For those who are joining us today, thanks again. And for those of you watching on demand, really appreciate it and would love to have your feedback as well. Take care, everybody, and have a great day.
Take care. Thank you.
Bye now.